Greg Meskel here with you. Thanks for joining us. More at home with USA Water Polo content. This week, our whole theme for at home has been return to play. And as we say before every one of these conversations, we have to add the important caveat that we know that depending on where you are in the country, you are in different stages or phases in getting back to having access to your aquatic facilities. So maybe you're back in the pool, you're practicing, you're able to pass and swim and those sorts of things. Or maybe you haven't even gotten back in the pool yet and you're still waiting to do that. The premise of all the conversations this week are to help you do those sorts of things as safely and as healthy a fashion as possible. And continuing with that trend, today our conversation focuses a bit on how our USA women's national team is making their way back into the pool. And to do that, I'm thankful to be joined by Dr. Elmo Agatep. Doctor, great to have you here with us. And just to kind of kick things off, just give folks a little bit of insight on the types of things you work on and your connection to Team USA.
Yeah, thanks. Thanks, Greg. It's great to have me here. So I'm a board certified family physician. I practice out of Seal Beach, California, which is close to where the women's water polo team trains out of. I'm also board certified in sports medicine and have been practicing in sports medicine for almost 20 years now. My connection with the women's water polo team is that I'm their team physician, and mostly I help coordinate their medical care with their medical providers and their main trainer as well too. I travel with the team as well too, and have also taken care of several other national teams along with that one as well.
Excellent stuff. And we know that you've been alongside with Larnie Bocarin, who we talked with earlier this week, to see some of the great accomplishments this team has had and make sure that they're healthy and safe. And as we're talking about them getting back to play, before we talk about them getting back into the pool, and I know Larnie's talked about this as well during the week, but what are some of the things that these athletes have been doing, and athletes in general that compete at a high level have been doing to stay fit and stay injury-free as they prepare to get back to their normal sports?
Yeah, so this is quite unprecedented time for many of our athletes. And definitely the coronavirus crisis has created some difficulties and some hurdles for us as far as how we stay fit before we go back and reintegrate back into training with our teams. Many of our athletes have found really creative ways to actually train outside. Some of them have been able to find pools that afforded them time to actually swim and keep their cardiovascular fitness up. And a lot of times our athletes have had to kind of jury-rig their training and find ways to train on dry land as well too. Our athletes have been quite mindful and have been working in close contact with both our trainers and their strength coaches as well too. And they've been given training schedules and workout routines that would help kind of keep them fit. A lot of the athletes that we deal with, oftentimes it's a concentration of both, cardiovascular fitness, maintaining that one, along with maintaining their strength and flexibility. Then those two realms are actually critical for helping maintain both their functionality and ability to reintegrate quickly, and also keep them injury-free as well too, because we know that oftentimes the lack of training facilities and the lack of a schedule oftentimes can breed malaise in athletes and lead to deconditioning, tightness, which are main factors for injuries to the athletes as they come back.
You hit on some of the key physical attributes of staying ready and making sure that when you have to get back to training, you're able to do so without injury. Let's talk a bit about the mental side of things, and especially for high-level athletes that are used to being in a routine. This has been a complete departure from what they normally know. How have these athletes, and what are some kind of best practices athletes have gone through to stay mentally engaged and stay positive when they're not able to work on their goals like they're used to?
Yeah, the mental game, I guess it's a huge part, and I do apologize for not touching on that one. At the national level, they're quite fortunate because their coaching staff and the organization itself is very cognizant of how important the mental game is. During the off season or this time off, the national team has worked closely with their sports psychologist, and they've had Zoom meetings regularly with their team, along with their psychologists as well too, to keep their mental game up. A lot of it has to do with staying mindful, making sure that they keep their goals in mind and focusing in on those goals. and then also maintaining kind of their mood as well too, and finding the positive in these hard times. And these are actually things that I also apply to and the athletes that I take care of here in my clinic who are not at the national level, because that mental game is so important. So, maintaining and visualizing yourself playing out there and taking the time to actually, for lack of a better term, meditating on that part and focusing in on those goals are quite important. And bracketing time out during your day, not just for your physical goals, but also for your mental goals, because that's quite important to stay sharp in that end as well.
We're talking with Dr. Agatep, team physician for the USA Women's National Team. If you have any questions for those watching live on Facebook, feel free to leave those in the comments, and we can pass those along to Dr. Agatep as we go. Women's National Team, many know they train at the Joint Forces Training Base in Los Alamitos, California. I think as teams start to work their way back into the pool, and they're watching a lot of news on how other teams are starting to get back into their competition. You hear about pod systems and bubbles where it's the NBA or professional soccer. Just give us an idea, as the women's national team has embarked on getting back in the water, what does that daily process look like? It's not just the whole squad showing up and jumping in the pool like it used to be. There are a lot of steps involved.
Yeah, and we've worked extensively on the off time to create a stage plan to reintegrate the team. And many people have been very helpful in creating these stage plans, from the levels of the USOPC all the way down to Larnie and the coaching staff and the players as well too. So we're very fortunate to have a multidisciplinary team come up with that stage-wide approach. Yeah, and we definitely focused in on a slow, gradual reintegration of the team, creating stages where there's specific goals that have to be met before we move on to the next stage, and keeping in mind how these goals will be fluid. And it's going to be responsive to, infection rates in the community, what the virus is doing, and also take in consideration the comfort level of our athletes and our coaches and how fast we can reintegrate back as well too. We also created training pods for the team, so that way we can split up their time and decrease the density in which the athletes get together. And that would decrease the chances that there's incidental contact that may lead to spread of infection should there be a breach in the team. And these pods will remain separate during the period, during the stages that we have, and as we progress to the stage and it becomes more safer, based on, again, the prevalence of the virus and the infection in the community, we'll start to consider reintegrating the pods back. These pods are super important. Part of it is because they represent bubbles in which, if there is ever a breach or an infection were to happen, we can isolate it and the rest of the team won't be affected by any slowdowns or any testing or quarantining that may happen as a result of it. And we're applying that as well too to the community that I take care of here, and I'm making those suggestions to the coaches. And they're finding it to be helpful because not only does it decrease the risk that there's a complete disruption in the training of the team, but also it gives the athletes and the coaches at least some sense that we're doing something for the team to keep them safe, and minimizing that risk as well too.
A lot of people hear about things like daily temperature checks or questionnaires, those sorts of things. Are those part of what you're seeing most teams go through as they get back in? Are there some just basics that most sports around the country, as they kind of restart at that higher level, that they're having to go through?
Yeah, and even in the lower levels as well too, those are integral parts of actually keeping the team safe. And it's going to be contingent on the resources that are available to the team. But at the basic level, the questionnaires are important in asking whether or not there's any presence of symptoms or if the athletes are symptomatic for something. And also temperature checks are something quite feasible and easily done logistically. So those are kind of the fundamental things that I think all teams should adapt at least, in making sure that their athletes are safe. And then as the availability of funds and the availability of testing and that's available to the team and the organization, you can see testing that's actually as extensive as what the NBA is doing, which is 3 times a week testing, screening for the coronavirus. For our team right now, we initially tested and screened for the virus before we reintegrated the team. And currently we're in discussions about intervals of testing. And we definitely just finished another round of tests with consideration to possible exposures because of certain events that have happened in the community where the players may have been exposed outside as well.
Yeah, there's a lot to consider. We're talking with some of the other medical professionals this week. It's been interesting to talk about the response to COVID in the realm of sports, because so many of these athletes are used to functioning as a team and kind of working to help each other. And it seems like there are so many parallels between what they do as a team playing water polo and the responsibility to work together in this united health effort. Really a sense of personal responsibility to make sure the group is successful when it comes to health.
Yeah, exactly. And it's quite interesting, actually, the parallels that you can draw with that one, right? That sense of team is very important, not just in the physical level, but at the mental level and philosophically, right? Where we ask our athletes to not just apply those concepts of, looking out for the team and doing what's best for the team, but doing it outside in their real life, because what they do outside in their real life affects the general health of the team and how much we can continue to train and how much further we can go as far as reintegration is concerned. So we do ask our athletes to be mindful at every level, from your little league to the rec leagues, all the way up to club sports and the national level. That mindfulness is very important, and it does take a little bit of sacrifice, but I think those are sacrifices that I think many of our athletes are familiar with, right? It's just the application of it to the life outside is going to be very important.
And especially you are spot on when you're talking about athletes at this Olympic level. They've already made so many sacrifices to chase their dreams and to give up things to focus on this greater team goal. And turns out this is just another one of those things when you're talking about being aware of your pods and who you're around and that sort of thing. You talked about keeping an eye on the numbers going forward, on developments. Now that training has gotten back in the mix, even in this small way, right, with these pod groups and kind of alternating times and all that sort of thing. What are you looking for going forward from a medical perspective to kind of feel like, okay, this is good, like we can start to make those steps towards greater integration to the full roster?
Yeah, so we keep an eye out and we use the data that we can get from the various public health departments out there, both statewide and regionally. We look for infection rates in the community, and certain regions and our state actually has certain goals as well too. And we use, and our state actually used the prevalence rate of infection, and yeah, one of their goals was to see the infection rate drop below 10% before we allow certain businesses to open. And I think we're going to be using those same goals as well too. And part of it because it's a good universal goal, and that's guided by good data and by professionals who are actually doing this for a living. So we're looking for rates to drop certainly well below, like maybe 7% is a good goal for us to look at in the community. And at current numbers, it's quite over that one. I think from last numbers that I heard, the prevalence rate of it is about 14% of the population is infected currently, which is still quite high, and it's climbing. So we're hoping that as we become more cognizant of these numbers going up and the more aware the public is about it, and the better those numbers drop, the more safer it is to allow reintegration to happen and help it proceed forward.
We're talking with Dr. Agatep, team physician for the USA Women's National Team. We talked about some of the return to pool workouts. There's, of course, Dryland Training as well. These are highly motivated athletes. We touched on it a bit earlier this week as well. How do you guard against whether you are the Olympic hopeful or you're just the age group athlete of not injuring yourself as you're so anxious to get back to what you were doing?
Yeah, that's actually, so that's a big one. And I'm all quite guilty of that one as well too, just because I engage in sports outside as well too. And as soon as some of the restrictions went down, it was kind of like letting a rubber band, I mean, it was like snapping a rubber band. All of a sudden you just want to go, full 100% right away. Keep in mind, and I recommend these to to our athletes as well as the people that I take care of in the community, that consider the time off that you've had, despite all the training that you were doing, to actually allow yourself a gradual return to play, and don't be over anxious to actually go back to your normal customary training schedule and your training intensity. So a gradual return back, allowing yourself to focus in on all those goals, right? Getting your cardiovascular fitness back up, your mobility and your ability to actually move through your range of motion, increasing resistance as you progress forward. That way you don't injure yourself, and keeping in mind that how important also the prehabilitation process is. So doing your stretches, making sure that you actively activate your muscles, stretch before and stretch afterwards, ice down any injured areas, making sure that those are also taken care of, along with like the training that you do in pool or in dry land as well.
We touched a bit on dry land, but as it pertains to Team USA, for those that have been to their facility, it's a pool adjacent to a weight room. We've talked a bit at this topic during the week about being in the water and chlorine, and there being a sense that if you're fully submerged in the water, that's an area that perhaps the virus can't survive, but there are so many other surfaces. I think of a weight room chock full of surfaces. When the team is using that for weight training, dry land, what are some good protocols there? Is it a full wipe down of everything before the next person moves on? Is it time interval? What's the best way for teams to handle that, and how's Team USA doing it?
Yeah, so in dryland training, we've actually established protocols of being conscious to wipe down the equipment after each use. As long as you use substances that are actually has been authorized to clean COVID effectively, that would be a really, that's kind of part of our protocol to make sure that those equipment is safe. Time off of in between people using it, as long as is not necessary, as long as the equipment is wiped down very well. So that's at least the least amount of care that should be given to making sure that the infection doesn't spread. We still take in mind that these incidental touch for infected objects is still a good source for infection, but as long as you do make sure that those equipments are cleaned and wiped down, I think you're fairly safe to actually proceed forward and to the next person using it.
And for any of us that have been to a fitness center, gyms for years have been asking us to wipe down your machine after you're done, wipe down your weights. Now you really need to do it. It's really important. It's going to help not only you, but the person that follows you when they're using the equipment. Another question that comes up a lot, and I think of the USA Women's National Team, they have a larger staff than perhaps a club team that maybe has just one coach or two coaches. But for Team USA, you're talking about someone like yourself, Larnie, head coach Adam, assistant coaches. How do the staffs integrate with the team, and are they part of pods? How does that work?
Yeah, from what I understand, we actually have the coaches be part of pods as well too. So they're assigned specific days where they're training with each one of the pods, and they're responsible for helping kind of make sure that the protocols that we've set forward are observed very well. They themselves are quite good. I've been to the pool and observed the coaches, and quite proud of how they've actually have been very good about using hand sanitizers anytime they touch incidentally objects that could be touched by other people as well too. So at least I've seen them set good standards for their athletes to kind of follow as well too. So they do actually are part of the pod and are kind of like the shepherds to that pod as well too. And it's a great thing to watch, and it should be actually something that all organizations should kind of follow as well.
And this is where we have to make the joke that the athletes stuck in Adam Krikorian's pod on the short end of the stick here. They do not want to deal with the head coach all the time. They'd much rather be with Chris or Dan or someone else. I've been asking the doctors all week long that we've talked to kind of a very open-ended FAQ. What are the questions that you keep getting? Every patient you see, your family that's texting you, hey, cousin Elmo is a doctor. What does he know? What are some of the questions you're always getting and important things you want people to know during this pandemic time?
Yeah, so the biggest question that I've had, because it's so much in front and center in the news, is about the use of masks. And I think that's a big hot topic, right? Part of it is because it no longer occupies the sphere of just good public health and looking out for your fellow, community member, but it's become politicized, right? So to remove that from that one, and I try to divorce myself from all those touchy subjects, is that, I tell people in my life and all the people that I come in contact with, is that mask use, the data is indisputable. Masks do prevent infection from happening. And the wearing of mask is an act of care for the person around you as well too. It will keep infections down. It will keep the team training. It will help advance us and move us through the phases of reintegration. So make sure that you keep your masks on, especially given the numbers of coronavirus that's going on right now. It's quite essential for that one. And, there is no, it's just, there's no doubt in the data that it does work. And there are some exceptions to people who can't use it, but it's more rare than common. And the use of masks does not cause harm for the normal, healthy individual, especially in the athletes.
And if you're scoring at home, that's 4 out of 4 doctors this week who have said wear your mask. So for whatever that's worth, it is across the board a feeling that everyone seems to agree on. Other things that get repeated as a mantra almost over and over again: social distancing, stay 6 feet apart, kind of, as you were alluding to with the pods, attempt to keep track if you've been in contact with people that you then know have had COVID. What are some other things that are kind of best practice things for people during this time, whether they're playing water polo or not?
Yeah, so you mentioned several big factors. All the other infection prevention, staying 1.2 meters away from somebody or 6 feet from somebody. Indoors is a much more higher risk environment than outdoor settings. So if teams or individuals can train mostly outdoors, it's a much more safer environment because of airflow, as well as making sure that you are very good about washing your hands. It should become a regular thing for everybody to get used to, either with soap and following the CDC guidelines on how to do it, 20 seconds of washing all surfaces of your hands, or using an authorized hand sanitizer with at least 60% isopropyl alcohol content in it. And as well too, and I think the big one that I get a lot as well too is, now that we are opening up the society more, the temptation is there to allow yourself to go out and be among the masses. I still recommend to this day that if you can avoid traveling outside or being outside, especially if the environment is going to be crowded, try your best to avoid it as much as possible, keeping in mind that there are other goals that you have, right? That you want to stay healthy for your team, that you want to stay healthy for your family, because at this point, it's still a very contagious virus, and you don't want to spread it to your loved ones as well.
We're talking with Dr. Elmo Agatep, team physician here for the USA Women's National Team. Just a couple of more questions here before we let him go. Another question we get all the time is, we're just taking baby steps here, right, to get back into the pool. As we talked about at the top, some teams like the Women's National Team are back in the water. Others have not gotten the clearance to go back into their pool. As a reminder, those decisions are coming from your local area. So your local health official, your local facility managers. That's not a USA Water Polo decision to say when a pool does or does not open. That'll come from your local area. But to that point, Elmo, a lot of people want to know, hey, will my high school season happen? Am I going to be able to get back and play with my teammates and have mom and dad in the stands? Is there anything people can kind of look to for guidance or reference, things they should be paying attention to understand whether this is moving towards that direction or away from that direction?
It's such a moving target. I mean, at this point, I would probably say about 3 weeks ago, there was probably more of a indication that we will be opening up really soon. But as our numbers started to spike up, a lot of organizations started to clamp down, and school districts started to clamp down. City pools delayed their reopening. Certain school districts have also delayed their reopening as well too. Much of the decision as far as opening up pools and opening up gyms and training centers are still very much in flux. At this point, I do reference a lot of, I do reference school district websites, public health websites as well too. Consulting your local public health websites, including like, if you're in Orange County, it's the Orange County Health Agency. If you're in the LA area, it's the LA Public Health Department. And those are websites and data points that doctors, public health officials, school officials use to actually inform and how they're actually going to open up. And at this point, it's hard to commit to a time when I think these areas are going to open up. It's going to be in flux, but I try to maintain like an optimistic viewpoint as far as when these places will open up as well too. And it's very hard to gander a guess without kind of pigeonholing yourself to something that will disappoint a lot of people if you start making those guesses. But stay optimistic, and that's the key. I think with optimism, I think in the beginning with us as well too, we with the opening of and reintegrating the women's national team, it looked bleak for a while, but as we saw those numbers dip down, staying optimistic did help a lot as far as keeping at least the mindset of our athletes in the game.
And another question that comes up, and you talked about the testing that the women's team is undergoing, and once a week, and talking about perhaps increasing that interval. I think the average athlete is wondering, I feel okay, but should I be getting tested? Should everyone get a test? And then we'll kind of know where things stand. What's the general consensus on that among the medical community?
Yeah, so we're in polling my colleagues and talking to them about like how often should we be testing, you'll find that the opinions vary. But keep in mind, there's one thing that we do all agree on is that asymptomatic carriers, people who actually do not demonstrate any symptoms at all, represent a fairly significant number of people who actually can spread the virus around. Estimates can run as low as 2% to up to 44% of individuals in the region can have the virus and not know that they have it because they have no symptoms. And the preponderance of those individuals are actually young. So, so people who actually are water polo players, from the junior levels all the way up to the elite national levels, there are, people who walk around with the virus and not have it. So I think testing is going to be very important, and it will help inform us on how prevalent the virus is and how invasive it is in our community. So that way we can protect everybody, because you never know who's going to suffer severe disease, because at this point we do have some indications on which individuals may suffer bad complications or outcomes when they get infected with coronavirus. But we also, there's a lot of factors that we don't know yet. So protecting yourself and knowing how prevalent the disease is out there is going to be very important. And I think regular testing is going to play a huge role in keeping our athletes safe, right? And allowing this to continue, so that way we can continue on our road to Tokyo safely and without breaking stride as far as training is concerned.
Dr. Elmo Agatep, team physician for the USA Women's National Team. Really appreciate you taking the time to join us here today and explain all of this stuff. I think really useful information. And also thanks for everything that you do to keep the Team USA athletes healthy and in the pool.
Oh, my pleasure. And thank you so much, Greg. I enjoyed talking to you.
All right, we'll talk to you soon. Thanks again.